Good afternoon. My name is Babygirija, and I'm a cell and molecular biology graduate student from Dr. Laming's lab. The title of my today's talk is Beneficial Effect of Dietary Protein Restriction on Alzheimer's Disease Pathology. So, as everyone knows, aging is one of the biggest risk factors for most of the neurodegenerative diseases, and metabolic dysfunction is a key problem in most of the chronic diseases. And since AD is an age related disease, we hypothesize that geroprotectors can be candidates that can delay or prevent the progression of AD. And dietary interventions, including caloric restriction, which is known as the gold standard of many of the anti aging interventions, is shown to extend health and lifespan across various organisms. So, protein restriction is also known as to be as potent as caloric restriction in improving health as well as lifespan. So, many clinical studies have shown that dietary protein is associated with cardiovascular mortality and dysregulated metabolic functions. Um, the studies on animals especially in rodents, have shown that how low protein diet affects aging, especially the macronutrient compositions varying and how they affect the metabolic health and lifespan. And this is nicely shown in this chart where we can see that the maximum effect or the maximum beneficial effect of macronutrient composition is with low protein, high carbohydrate, where we can see that it improves the metabolic health and lifespan across various uh, organisms. So that brings us to our question, like what is the impact of a low protein diet on Alzheimer's disease pathology, especially on metabolic health and cognitive impairment? And for that, in order to test our hypothesis, what we did was we had a triple transgenic Alzheimer's disease model, which is the 3xTG model that is widely used. And this has three mutations, the AP, the presenilin, as well as tau. And the phenotypic characterizations is that they start to show A beta plaques from 6 months, and hyperphosphorylation of tau in the hippocampus is shown to be from 12 months, as well as their cognitive impairment starts from 4 months. So following this, we have a control mice and we have both male and female. And starting from 6 months, we place them on either of these two diets. One is a control diet, which has 21% protein calories diet, and a low protein diet, which has 7% protein calories diet. Both the diets are isocaloric and the fat is constant, and the only change is the carbohydrates. And following the mice kept on these diet for 3 months, we did metabolic phenotyping as well as behavioral testing. And soon after 12 months, we sacrificed the mice and took their tissues and did some molecular work. So I want to show some key results based on these studies. So what we first did was we looked at if there is an effect of protein restriction on glucose metabolism, and for that we did a glucose tolerance test. And what we found that protein restriction improved glucose tolerance when compared to all other groups that were fed on a control diet. As we could see nicely from the area under the curve graph, that a mouse that is fed a low protein diet had significant improvement in their glucose tolerance when compared to their corresponding wild type glutamates. And moving on, we did some cognitive test on these mice, and what we found was that in open field tests where we test the anxiety and the locomotor activity, we found that protein restricted animals had reduced anxiety as well as increased locomotion. And we also performed novel objective recognition test where we found that protein restriction improved cognitive functioning in a mouse that was fed a low protein diet in long-term memory test when compared to their control fed animals. And finally, we also looked at their tau hyperphosphorylation in the brains of these mice, where we could see that protein restriction decreased tau phosphorylation in the mouse that were fed low protein diet. So in short, what we found was that protein restriction can improve metabolic health as well as cognition and Alzheimer's disease pathology in a 3xTG mouse model. So suggesting that there is an improvement in finding better dietary interventional therapies to cure AD. Thank you.